Retirement often means more travel, visits with family, or even moving to a new state. Medicare doesn't always follow as smoothly. Original Medicare generally works anywhere it's accepted, but Advantage plans depend on networks. In this video, we'll cover travel rules, moving steps, and prescription tips so you can prevent gaps and avoid costly surprises. Palmetto Mutual is here to guide you every step of the way. Retirement often means more travel, visits with family, or even moving to a new state. Medicare doesn't always follow as smoothly. Original Medicare generally works anywhere it's accepted, but Advantage plans depend on networks. In this video, we'll cover travel rules, moving steps, and prescription tips so you can prevent gaps and avoid costly surprises. Palmetto Mutual is here to guide you every step of the way. Even with original Medicare, not every clinic or specialist participates, and rural areas may have fewer options. Call ahead to confirm acceptance before traveling. Remember, Medicare's exclusions don't change. Dental, vision, and hearing remain uncovered, and prescriptions need Part D. If you plan checkups or follow-ups on the road, verify participation early to avoid billing problems or delays in care. Advantage plans are like toll booths. Your pass only works in certain lanes. HMOs cover emergencies away from home, but not routine visits. PPOs allow more access, but often at higher costs. Some plans add temporary traveler programs. Before long trips or seasonal stays, review your plan's network rules and ask about options to avoid paying out-of-network prices unnecessarily. Pharmacy networks vary from state to state, even within the same chain. Before traveling, check which pharmacies are in-network where you're going. For extended stays, order a 90-day mail refill shipped to a secure address. If you lose or run out, most plans allow an emergency fill or vacation override. Keep your plan's number handy to find help quickly. Moving changes some Medicare parts, but not all. Original Medicare transfers automatically. You don't need a new card. Advantage and Part D plans are tied to your zip code, so relocating usually means enrolling in new coverage. You'll get a special enrollment period lasting 2 months after you move. Use that time to compare local costs and networks. Special enrollment periods give you a chance to adjust outside regular windows. A move outside your plan's service area qualifies, and other events, like losing employer coverage or your plan leaving the market, do too. If you have Medicaid or extra help, you may switch more often. Mark deadlines, gather proof of your move, and contact plans promptly. Original Medicare doesn't usually cover care outside the U.S., with only narrow exceptions like certain cruises or border emergencies. Some Medigap plans include limited foreign travel benefits, though with deductibles and lifetime caps. That's why many seniors add travel medical insurance, especially for evacuation or hospital stays abroad. A quick review before departure protects both health and wallet. Splitting time in 2 states takes planning. Original Medicare with a Medigap plan usually offers the most flexibility. Some Advantage carriers offer snowbird programs, but networks still matter. Medicare requires one permanent address, which sets plan choices and costs. For prescriptions, use mail order or national chains and arrange 90-day supplies before you leave to keep refills simple. Medicare treats temporary visits and permanent moves differently. Short stays don't require plan changes, but permanent moves do. Always update Social Security, notify your Advantage or Part D plan, and set up mail forwarding. Keep premiums paid during the transition. The most common mistake is letting Part D lapse, which triggers lifetime penalties. A checklist prevents problems. Start early so you're not rushed. 3 to 6 months before moving, check plans by your new zip code. Compare premiums, networks, and drug lists. List the doctors, pharmacies, and hospitals you want to keep, and verify participation. Costs differ widely. Rural and coastal areas often show big changes. Early comparison helps you land the right plan on time. Medicare rules don't have to be confusing when you travel or move. Confirm providers, know your plan's limits, and use special enrollment periods when relocating. Plan ahead for prescriptions and consider travel coverage if heading abroad. With Palmetto Mutual, you get clear, local guidance, not guesswork. A short checklist and expert support keep your Medicare coverage simple, reliable, and ready wherever retirement takes you.